this lecture, we will review sex workers' well-being. What are the risks of sex work? There are a variety of images of the contemporary prostitute. She's young, attractive, healthy, and happy, also known as the happy hooker. Young, brazen, aggressive, the tough chick. Not so young, bruised, emotionally and physically. A victim. Which one is valid? Well, according to a landmark study, all of these images are accurate. Researchers in the Netherlands recruited 100 women who had been working for at least 1 year of a study of sex and health. These women were interviewed and completed several measures of coping style and well-being. The samples included women who worked on the street, in windows, in clubs and brothels, for escort services, and in their own homes. The results indicated that 1/4 of the women were doing well. They had few physical or psychological complaints, used problem-focused coping strategies, and were satisfied with their lives. Another quarter were at the opposite end. They complained of headaches, backaches, anxiety, and depression. Their coping strategies involve dissociation, seeing problems as unrelated to the self, and denial. They were dissatisfied with prostitution. The remaining women were somewhere in the middle. Now, the risks to a woman and thus her well-being varied according to the venue in which she worked. In the Netherlands, where sex work has been legalized, women who worked in windows and on the streets were at greater risks. Work in the streets was associated with greater risk of arrest and of violence by clients, which obviously influences physical and mental health. Women who worked in windows or on the streets worked faster, had more clients, and earned less per customer than those working in in-call and out-call services. In a more recent study of indoor sex workers in the Netherlands, workers reported having an average 9-hour workday. More than 1/3 worked in excess of 40 hours per week, and half had taken no holidays in the past year. Scores of indoor sex workers on measures of burnout, depersonalization, and emotional exhaustion were compared with scores of female health workers and persons in treatment for work-related problems. Sex workers scored significantly higher on depersonalization, which was mainly explained by contextual factors, working due to coercion, experiences of violence, and lack of control in interaction with clients. An important caveat in interpreting these studies is that they were conducted in the context of legalized prostitution in the Netherlands. Doubtless, the health outcomes would be worse in countries in which prostitution is illegal, and therefore prostitutes have little recourse, if any, if, for example, they were assaulted. A unique study of the geography of sex work victimization used reports filed by sex workers in New South Wales. An outreach program there encouraged workers to voluntarily report instances of victimization they experience. An analysis of 333 reports filed over 8 years identified 528 criminal acts. 1/5 of the acts involved theft, including stealing, defrauding, and non-payment. 1/6 involved harassment, including stalking, nuisance behavior, and threats. Other actions included disorderly conduct, assault, and abduction. Most incidents occurred indoors, regardless of the venue. Victimization occurred in the assailant's car, mostly for street work. The premises, mostly in brothels. The assailant's home, mostly for call-out work. Or the worker's residence, mostly for call-in work. The authors of the study concluded that privacy and the workers' lack of control are major situational contributors to victimization. Now, in an attempt to reduce street prostitution and to reduce risks for sex workers, risks are especially high for women who are being trafficked because they are at risk for suffering abuse and injury by both clients and quote-unquote masters, undergoing illness and infection, and facing medical neglect. There is also the risk of exposure to sexually transmitted diseases, especially HIV and AIDS. Prostitutes infected with HIV are often workers who are also injecting drugs, with research indicating that it is the injecting that is the risk. In the Western world, studies show that the sex worker risk of HIV infection is greater in his or her private sex life than in their sex work. In other parts of the world, the risk varies greatly, with high rates of HIV/AIDS in some cities and countries, but low in other countries. Now, it has been suggested that the high levels of violence and the psychological distress found among sex workers are not due to the nature of the work per se, but instead reflect the stigma associated with the work itself. Prostitutes are at high risk of rape because of attitudes such as the view that you can't rape a prostitute, but no harm is done if you do. Sex workers use a variety of strategies to cope with risks of their work. Some use drugs and alcohol to increase their confidence and decrease guilt. Others use a strategy of shutting down their feelings and focusing narrowly on the task. Other consequences of this distancing are also referred to as depersonalization, not, of course, an experience unique to sex work. Independent women may view themselves as professionals, providing therapy, sexual healing, or sex education. They may take courses to enhance their skills, for example, earn massage certification, or use prior training as a therapist or social worker. These women perceive their work as offering opportunities for personal growth. Some emphasize the rewarding aspects of the work as perhaps that it supports their children. Many sex workers use as a coping technique the careful management of time and place, locating their sex work in a specific physical and temporal place separated from their private lives, sexual and family relationships. Sex workers may also use a network of contacts with other sex workers as a source of support. In one such case, workers on the quote-unquote stroll, worked together to protect a pregnant colleague by giving her all the customers who wanted a quote-unquote blowjob and protecting her from clients known to be rough. Thus, sex workers face risks due to discrimination, criminalization, and exploitation, and perhaps due to violence, disease, and drug use. There are promising approaches available that can reduce harm, including education, especially job training, empowerment, preventative health care, and improved occupational and safety conditions. There are also interventions that have been shown to work, including peer education, training in sex safety negotiation skills, and provision of condoms. Several sex workers' rights organizations are working to reduce the risks to sex workers and provide social, medical, and legal services to them. In my next lecture, we will review the role of early abuse in becoming sex workers.